Hi, my name is Hazel Buckmeyer Austin, and this is my survivor story. Heart disease is, what should I say? The family has heart disease. Both of my parents died from heart disease at 54. So in the back of your mind, you know to yourself, I'm a nurse on top of that somewhere along the line, you have the genes for heart disease. However, over the years, I thought I could manage the disease and the condition myself. I started, at first I thought with having the chest pain, which is like the main thing that I could really identify, that I could manage it on my own. I just unfit, I need exercise and that kind of thing. But over the years, the chest pain increased. I sought medical attention and I was told I had angina, which is what my dad had and then my mom had. So, it's running in the family, you see. But over the years, the pain became increasingly worse. I did not have the traditional symptoms of shortness of breath, palpitations, the kind of things that you read in the book about heart disease. My main symptom was chest pain, and I mean severe chest pain. It was so severe that I learned to cope with it. So if I was walking from here to there, believe it or not, my chest would hurt. I would stop, pain would eventually ease off, and then I would go again. And that continued for over two or 3 years. Finally, one day, I was at work and my chest kept hurting me more and more and more. The doctors had prescribed the spray that I usually use under the tongue, nitroglycerin spray. I never used to use it. I would only use it when it was what I considered really necessary. However, this particular day, I used the spray, and when you use the spray, you feel better, but you feel kind of lightheaded as well. And I was feeling really lightheaded. So I sat down for a little while at work. I didn't tell anybody. I work in a polyclinic with doctors and nurses. I didn't tell anybody anything. I could manage this, right? And I then left and went home. During the course of the night, the chest pain came back, really severe. And that's when I decided, this is it now, it's time to go to the hospital. So I went into the hospital at the QEH, the rest is history. I had to have open heart surgery. Coming out of that, I would like to encourage people with chest pain and other symptoms of heart disease. Do not take it lightly. Do not take it lightly. Always seek medical attention. And for the healthcare workers just like me, do not diagnose, treat, and manage yourself. Because we always feel we could do it. We always feel we could do it, right? When the doctors did the investigations, my arteries were 99% blocked. Yep. And since I've had surgery, I've never had chest pain. The chest pain is gone. My blood pressure has come down, and I exercise 3 times a week at the Heart and Stroke Foundation, and they have helped me a lot. So I say to my colleagues, and not only my colleagues, anybody else listening, please try and seek medical attention. Do not wait until it is too late, because I almost waited until it was too late. There's always somebody out there willing to help you. Of course, you talk to the dietitians as well, and they would tell you about diet and change in lifestyle and that kind of thing. So diet and exercise has been the key for me. I have come from 9 tablets to 3. I'm still trying to see if I could come down to none. But I don't want to push my luck. You know how it is, you're working, it's stressful, life is stressful. But it's always important to take care and take the advice from your medical and your health people. They will help you.